Hello everyone. So here we have a newborn infant. The blood gas is given and the chest X-ray is given. So based on the blood gas, chest X-ray, and information given, what first of all, what is the diagnosis here? That is very evident. And how would you calculate oxygenation index and alveolar arterial oxygen difference? Because that will decide how sick the baby is, and you might have to escalate the support and send the baby to a center where they can do ECMO, which is the case here. So let's first see what's the diagnosis. So as you guys can appreciate, that you guys can see that the right lung has all these finding which look like the gut is there. So this is congenital diaphragmatic hernia. So that's easy to make. The patient, these are the ventilator settings, which are not that high, but again, you have to know that to calculate the oxygenation index and later on calculate the alveolar arterial oxygen difference. So here the FiO2 is 100%. So definitely this baby is hypoxic, and this baby is probably going into the persistent pulmonary hypertension. The base deficit is more minus, so that means baby is acidotic, and here you can see that, and it's a respiratory and metabolic, so it's a combination, as you see the bicarb and as suggest, because you cannot oxygenate and later on you have the metabolic component, so that goes there. And the PaO2 is the most important finding in this gas, and let me rub it off. So whenever you see a gas, and especially in this type of diaphragmatic hernia or persistent pulmonary hypertension, always try to see the FiO2 and PaO2. See, you're giving 100% oxygen and your PaO2 is very, very low. 14 is very low, really. You're not oxygenating this baby. So there is, some problem, severe problem here. It could be cardiac, of course. First, you have to rule out the cardiac problem. You have to get an echo right away. But here, because we know the diagnosis, so we kind of know that this is probably because of the VQE mismatch, the patient is getting all this problem. So now let's go ahead and try to calculate the OI. So of course for OI and ADO2 you have to remember the formula. So for the OI, the formula is the mean airway pressure, which is 14 here, and then you multiply by FiO2, and then you multiply by 100 if you are doing like in percentages, so you have to do in decimals and multiply by 100 and then divide by PaO2. So again, let me rub it off. So 14 was the MAP, 100%, which is 1, then multiply and then divide, you get 100. So OI of 100 is very, very high. If you have 3 OIs of greater than 40, 50, that means the patient needs ECMO. So OI, always try to calculate. There are online calculator, but again, it's a simple mental math. Do it. Now what about the AADO2 or alveolar arterial gradient? As the name suggests, is the alveolar arterial oxygen difference. So of course you have to know first the alveolar here, alveolar oxygen, and then you have to know we already know PaO2, which is 14, as you guys can see here. So 14 is already given. So now how to calculate the alveolar O2? So it's very easy. You have FiO2, you multiply by the difference in the atmospheric pressure and water pressure. Remember, if you are in a place which is at the higher altitude, your atmospheric pressure will be different, but we are just calculating it assuming that this patient is at sea level. So remember that this 760 will change and depending upon where you are. So anyway, in this case, finally we subtracted that this is the CO2. We usually divide CO2 with respiratory quotient and we assume it to be 0.8, and so we do that, and then you saw that we got the alveolar PaO2 is 633, and then once you get that, it's very easy. You already know the PaO2, you subtract that and you got 619. So also greater than 600 suggests that there's a lot of shunting going on. So combining both OI of 100 and a ADO2 of 69 suggests that this patient with diaphragmatic hernia should be transferred to a center which can do ECMO or which has the facility of ECMO. The treatment of congenital diaphragmatic hernia is really depending upon the surgery. Most of the time they want to treat DPPHN, which is pulmonary hypertension, first and do the operation later, but again in certain cases the surgeons want to do it early. It's surgeon's call, and of course you have to read what are the different prognostic factor for congenital diaphragmatic hernia. Of course the right side is bad as compared to left side, and having the liver in the chest, and then there are certain ratios you have to remember. So anyway, the purpose of this talk is not talk about the congenital lipopenic hernia. The purpose of this talk was to just discuss among ourselves about how to calculate OI and how to calculate the AADO2. So I hope you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.